A 24-year-old male patient, Bruno, is brought to the emergency unit by the paramedics. He's complaining of a headache, fever, vomiting, photophobia, and rash. He has been to his local clinic where he was given analgesia and antihistamines, but there hasn't been any improvement. What is the cause for his symptoms? Hi, you are watching ED Files, and I am Dr. Thabo Mafa. The symptoms and signs of meningitis have been observed in patients for 1,000 years. However, its first clinical description was made by a physician, Thomas Sydenham, in 1681. Even though the statistics show that there is quite a decline of deaths related to meningitis, it still has a huge impact on the health or the quality of health of many patients. Let us now define what meningitis is. And together with that, let's get to a little bit of anatomy so that we have a picture of what is really happening in this case. Meningitis is inflammation of the membranes or the meninges that cover your brain and your spinal cord. And we've got three of them. From the outermost to the innermost, we've got the dura mater, arachnoid mater, and the pia mater. The dura mater is the outermost one, which is just very close to the skull. The arachnoid mater is in the middle, and the pia mater is attached to the brain tissue itself. And between the pia mater and the arachnoid mater, there is a fluid which we call CSF, or cerebrospinal fluid. In totality, both the CSF and the meninges protect the brain and the spinal cord. Perhaps you are asking yourself, what could be the causes of meningitis? And we've got several of them. You could have infections, such as bacterial infections, in a case of Neisseria meningitidis or Streptococcus. You can have a virus causing meningitis, fungus, and also tuberculosis. You can have parasitic infections, like in the case of cerebral malaria. Other medications as well that we take can irritate the meninges, such as chemotherapy or non-steroidal anti-inflammatories, and also some antibiotics. You could have autoimmune diseases such as multiple sclerosis or rheumatoid disease and Guillain-Barré syndrome. How does it happen that one would get this bug and eventually it results in meningitis? Now, this brings us to the roots of infection. We've got indirect spread, or we've got a direct spread. An indirect one would mean that the bug goes into the bloodstream and eventually causes an infection that is overwhelming to the body, that is sepsis. And if it remains untreated, it can easily go to the central nervous system and cause meningitis. A direct spread would mean that a direct inoculation. For instance, someone who's riding a bike and they are not wearing a helmet. They get into a crash or an accident. They sustain an open skull fracture. That can directly introduce the bugs into the central nervous system and cause meningitis. You can have invasive procedures like spinal surgeries, but in this case would be in a case whereby the instruments are not well sterilized. Bruno, a 24-year-old male patient, presented with the classical symptoms of meningitis. But what are the other symptoms a patient may present with? They could come in with a headache, fever, nausea and vomiting, neck stiffness, photophobia, that is sensitivity to light, or phonophobia, they could be sensitive to loud noises, or they can present with acute confusion or seizures and even rash. But this kind of rash in particular would be a petechial rash. This rash would have multiple red spots all over the body. When I examined Bruno, these were the findings, and these findings are characteristic of meningitis. He had Kennex sign. A Kennex sign is a reflex that you would have when you flex your knee and your hip, and thereafter you stretch your knee joint in such a way that it stimulates a reflex. And this reflex would be seen whereby there would be an acute pain that a patient experiences in the lower back, and they cannot really avoid it or inhibit the reaction they would have from that, and that would be a Kennex sign. They can also have a Brudzinski sign. Brudzinski sign would mean that when you flex the neck, the hips and the knee joints, by reflex, they would bend as a reflex. And like I said, a patient who's got meningitis wouldn't be able to stop it or inhibit it. They can have a petechial rash, one which we described earlier. He had fever. His temperature was around 39 degrees Celsius, and also photophobia. In the room of examination, he couldn't really face the light, or he couldn't even stand the light that we switched on in that room. That is light sensitivity. How do you then investigate a patient who's got meningitis? You have to do bloods to check your infection markers, inflammation markers, kidney function tests, and also glucose. Let's elaborate a little bit on those aspects. In cases of meningitis, but not all cases, but in most cases, the infection marker would be raised together with the inflammation markers. And what's the significance of a kidney function test? A patient who's got meningitis may sometimes present with confusion, and that could be a similar presentation with a case whereby a patient's got renal failure. And also, the significance of doing a glucose or sugar test is that in the case of meningitis, if it is bacterial meningitis, the level of sugar you find in your cerebrospinal fluid, in most cases, if it's bacterial meningitis, you'd have it being 2/3 less than the sugar level you have in the blood. You have to do a CT scan of the brain, and preferably it has to be done before you do a lumbar puncture, because in some cases, if there is a space occupying lesion that is causing a lot of pressure in the brain, doing a lumbar puncture prior to doing a CT scan can easily kill the patient almost instantly. You have to exclude things like space occupying lesions like pus in the brain, and also a tumor. And in some cases, you have to look out for things like toxoplasmosis from cats, and also neurocysticercosis from pork. You must do a lumbar puncture to examine your cerebrospinal fluid. You'll be looking at things like polymorphs and glucose level. You have to look at ADA, viral PCR, and cryptococcal antigen. And what are these things? Polymorphs are cells that would, in most cases, suggest if there is bacterial infection. The higher they are, the more indicative of possible bacterial infection. Glucose levels, as we explained, if it is bacterial infection, then the glucose level in the cerebrospinal fluid tends to be less as compared to one that you find in the blood. ADA is, if it's high, it would be suggestive of TB, tuberculosis, and together with high protein levels, if both the ADA and the total protein are extremely high, then you'll be thinking along the lines of tuberculosis or TB. Cryptococcal antigen would be suggestive of a fungal infection like Cryptococcus neoformans. Now that we have examined the patient and we've done investigations, how do we then treat a patient with meningitis? The treatment for meningitis depends on the cause for it. If it's bacterial, we have to put them on an antibiotic, and this is intravenous. Please do not try to treat meningitis from home. It has to be in a hospital setting. It has to be an antibiotic, preferably a third generation cephalosporin. If it's viral, it will be an antiviral if you have. And the duration for treatment for both bacterial infection and viral will be about 7 to 14 days. Fungal infections seem to be a little bit more stubborn, so you would have to put them on an antifungal in a drip, and that would be amphotericin B and also fluconazole. That would be for about 14 days, and that will later on discharge be followed by a period of about 6 to 12 weeks of oral medication of fluconazole. In a patient who is immunocompromised, the treatment tends to be even a bit longer. On the oral medication, upon discharge, the patient has to be on treatment lifelong. In some cases of meningitis, we also add a steroid, and this may speed up the process of inflammation, or reduce rather the process of inflammation that you would find in cases of meningitis. Let us now talk about prevention. How do we prevent meningitis? We have to make sure that our kids, our children, are vaccinated. We need to make sure that we follow the EPI schedule of vaccination. That is very important. In the case of meningococcal meningitis, which is very contagious, you can have droplets from a cough or even kissing, transmitting this infection to the next person easily. We have to make sure that whenever we do invasive procedures, the instruments that we use are sterile. And last but not least, we have to ensure that when a patient has got an infection like a urinary tract infection or lower respiratory tract infection, that they get treated as soon as possible. Because if they are not being treated, this can lead to sepsis and eventually meningitis. So now the question is, what could go wrong if the patient has not been treated for meningitis? Or even after treatment, what are the possible complications? You can have a permanent brain damage, and this would impact on your learning abilities. The patient may have seizures, blindness, loss of hearing, and sometimes a patient can die from meningitis. Now let us look into the case of Bruno. What could have happened? How did he get into this problem? Let's have a retrospective analysis. A week prior to being symptomatic, he was with his colleague in his office, and he also had a cough, fever, persisting headache, and also body rash. He was later rushed to hospital, and where he was diagnosed with meningitis. And specifically, he was diagnosed with meningococcal meningitis, which is very, very contagious. This would explain why Bruno also presented with similar symptoms. Let us now look into the outcome, what eventually happened to Bruno. The findings that we had on his investigations were as follows. On the blood sample, the infection marker and the inflammation marker were very high, and this would suggest that he's got an infection going on. The CT scan of the brain was normal, meaning that there was no space-occupying lesion or any other thing that would account for the headache that he had. On the cerebrospinal fluid from the lumbar puncture that we've done, the polymorphs were very high, the glucose level was low, and the protein was high. These were suggestive of bacterial meningitis. Bruno made a good recovery after being treated for the meningitis, and fortunately, he never suffered any neurological complications thereafter. And in conclusion, vaccination, early recognition of the symptoms and signs of meningitis, and commencement of treatment as soon as possible can save a patient's life. And thank you very much for watching.